Hi, I'm Rachel Watty from New Zealand Doctor. I'm here with Mark Fulcher. He's a sports physician at Axis Sports Medicine Specialists, and we're here today to talk about diagnosing concussions. What are the challenges diagnosing concussion?
So I guess one of the challenges is that often the number of symptoms and the symptoms the patient describes are quite varied and sometimes quite subtle. And when you're dealing with a clinic-based environment, the patient may not have any symptoms, so a high index of suspicion is very important.
Are there any existing guidelines to help GPs diagnose and manage concussion?
Yeah, good question. So I think a lot of time is spent focusing on what we don't know about concussion, and the fact that we have some very good international guidelines is often lost. So there's an international consensus statement on managing concussion in sport, and the most recent guidelines came out in 2012, and they've been subsequently endorsed by ACC, and they provide a good framework for this problem.
Can you tell me a little bit about what these guidelines involve? What are some of the tools that GPs can use?
Yeah, so there's some key issues there that have been raised, like don't return to sport in the same day. To be concussed, you don't need to be knocked out or have a blow to the head. So there's some key ideas around the injury itself, but there are a couple of really useful tools, and the one that I would really encourage everyone to have a look at is called the SCAT-3. It provides a standardised assessment tool for assessing concussion in a clinic-based environment. So there's a framework for taking a history, for taking an examination, as well as some emergency advice to give to patients and return to sport advice as well. So it really is a one-stop shop in terms of assessing concussion in a clinic. It can be done in 10 to 15 minutes, and it's a very good tool. So there's a checklist for symptoms, for example. So you run through the checklist, you quantify the number of symptoms and the severity of the symptoms. Then the examination, so there's a sort of more traditional neurologic exam, so some elements of that, but then also an assessment of the patient's memory, their orientation, and their balance, which are some things that probably are not being done in most clinics around New Zealand.
If someone's had a concussion, when's the best time for them to return to sport?
In order to get back to sport, you need to be symptom-free, and you need to be doing all your normal activities of daily life, because we know that sometimes sport and cognitive processing make symptoms come back. So once you're asymptomatic, it's okay to start a process of returning to sport, but we're advocating a graduated return to sport, starting with some basic aerobic exercise, progressing through to include some resistance training, and a return to sport at the end.